You will see that heart disease is the worldwide number one killer. To increase the awareness among the people, to prevent this occurrence, to have a global impact of this disease prevention, World Heart Federations along with World Health Organization has observed the World Heart Day on the 29th of September on annual basis. Heart disease for the common people is just a heart attack, but let me tell you, the heart is very complex organ. It involves its structure, it involves the coronary arteries. These are the arteries which supplies blood to the heart, the blockages in these coronary arteries, and it involves the wiring system of the heart. So problems in any of these structures or wiring problems or these blockages concludes the heart disease. So it can vary from poor heart functions, muscle hypertrophy, the blockages leading to heart attacks, or wiring problem leading to the palpitations, bounding heartbeats or irregular beats. Over and above, whatever the congenital heart disease in structure, all those forms the heart disease. Yes, people always confuse the heart attack and the heart arrest is the same. Heart attack is the place where there is a blockages in the blood vessel which supplies blood to the heart, and when this block becomes sudden, almost 100% block, these are the time where heart doesn't get the blood supply, and the dying of this muscle gives the pain. That is what is the heart attack. While the cardiac arrest is the complete cessation, the function of the heart. It could be because of blockages, it could be because of arrhythmias, or it could be some other reason. That is what is a cardiac arrest. While the heart failure means inability to pump the sufficient blood to the body is a heart failure. So in short, heart attack means blockages in blood vessel, cardiac arrest is cessation of activity of the heart, and heart failure is inability to pump the blood to the body. So you will see that 10 years back, when people who was young, those who are young females, when they come to us for chest pain, we hardly used to think about the heart attack issues. But recent change in urbanization, in change our lifestyles, with more of an unhealthy lifestyle, including junk food eating, not much of exercise, too much of stress, the competitive nature, we are of late seeing these patients are coming much earlier with more extensive disease. In acute heart attack setting, I always recommend patient not to get panic. I always tell them to calm down. If possible, they can take a 300 mg of the aspirin tablet, chewable, or in the water they can just drink it. Sorbitol tablets, some patients who already have disease do carry with them, that will help to relieve some pain. But most important, they have to cut down their activity. They inform the people nearby, and I always recommend to go by nearby office, nearby hospital to check the ECGs and consult a doctor. After a heart attack, the patient is twice more likely to get another heart attack. The life after angioplasty, I will say it can be awesome. The patient after angioplasty, they can have their routine life as if what they used to do, even more with more vigor. There are patients after angioplasties going for the Everest camp and all. But let me tell you, that comes with some terms and conditions. Where patient needs to be very compliant with medicine. They cannot take the medicines lightly. They need to do regular exercise, 45 minutes of moderate intensity exercise 5 to 6 days a week. We tell them to have their dietary changes in terms of fried, oil, sugar. We tell them to cut it down as much as possible. So we always tell them to cut down on their carbs, mainly the bread, maida, pav, cold drink, fast food, such items we try to restrict them. If possible, they can switch to the millets. Yes, and sugar need to be cut down. That is what is required. So 80% of heart disease can still be preventable. That's why the World Heart Day has been more been celebrated. You will see with better lifestyle in terms of better eating habits, lesser of junk foods, more of a fruits, green leafy vegetable, the seeds, the regular exercise, 45 minutes of moderate intensity exercise 5 to 6 days a week, getting regular health checkups, knowing your numbers like your sugars, like your blood pressures, like your cholesterol, definitely helps to reduce your overall heart attack event rates. Heart attack is a major setback for the patients. Let me tell you, you don't have to worry immediately after a heart attack, but you need to be very careful about your future life. We have seen patients when they present with an heart attack in an acute setting, when we timely treat it, we do any procedures, they can absolutely lead to a more near normal life or even better life. So after heart attack, you don't have to dishearten. You have to keep your lifestyles better. You need to be compliant with medicines. You need to be on a regular checkup with the doctors. In fact, many of our patients are there who are after angioplasty, in fact, has went even for the Everest camp, and they're living very successful life without any fear.